Today we're going to talk about diabetes and wound education. We are UIC nursing students in our population health class. My name is Leah, and I'm here today with Antonio, Selena, and Diego.
Hello.
Okay, so here's our pre-survey link. We would love for you to fill this out now just so we can get a good assessment of the knowledge level before the presentation. And then we'll also ask you to do it at the end to assess the knowledge. Okay, so here is our objectives. So first, by the end of the presentation, the viewers will be able to list 2 ways diabetes can lead to wound development. Second, by the end of the presentation, viewers will be able to list 2 changes they will make to their current lifestyle from the 4 options provided in this presentation. Lastly, by the end of the presentation, the viewer will be able to recite what the acronym TIME stands for in relation to wound care management. Okay, now we're going to talk a little bit about what diabetes is. So, diabetes is when the body cannot control the amount of sugar that's in the blood. It is a long-term disease, and some of the risk factors include obesity, physical inactivity, age, genetics, and diet. And it can cause damage to blood circulation, organs, and skin. And we're going to talk a little bit more about this later on in the presentation. Okay, so now how it's monitored. So we also provided a link below if you'd like to watch that again after the presentation. So the 2 main ways diabetes is monitored is with an A1C test and a finger stick. So the A1C is a blood test that tells us how much sugar is in the blood over about a 3-month time period. So this is a good comprehensive test to kind of tell us how well an individual might be managing their diabetes or how much blood sugar is in the blood on average. And then also we have the finger stick test. So this is an easier test. This will give you the level of sugar that's in the blood at that moment. So this number can be used to help to determine how much insulin is needed at that time. And this can be done at home multiple times a day by the patient and by you guys individually. Okay, so now we're going to get into a little bit about lifestyle choices that can help prevent diabetes and thus wounds. So first, diet. Diet is really important, and part of this includes eating fruits and veggies, whole grains, and protein. So on this picture, on the right side of the screen, we have listed a couple items that are really good choices. So avocado, orange, salmon, other things that are not listed are like bananas, carrots, broccoli, things like that. And then also it's important to limit our sugar and also our carbs, as well as limiting alcohol. It's important to limit carbs because these actually turn into sugars in the body. So when you're looking at foods at the grocery store, it's important to choose foods that are that say low in carbs and low in sugar. Every food will give you a nutrition list on the back that we can use to choose our food options. And then as well as exercise, the best practice is to maintain 150 minutes per week or about 20 to 25 minutes per day. These activities can include walking, housework, playing sports, dancing, whatever you prefer. And then it's also just important to control the weight, stop smoking if that applies to you, and then also to reduce stress. So some ways you can do this are by journaling or going for a walk, like I mentioned, spending time with friends and family, just whatever you prefer.
So I wanted to transition into talking about wounds. So for diabetes, having blood sugar for a long period of time can cause damage to your vessels and your nerves. And this can cause poor circulation, poor healing, and poor sensation of your feet. Now, all 3 of these things can lead to wounds and injuries of your feet and your legs. And this can lead to issues such as infection, and the worst case scenario is amputation. Now, an infection can reach all the way to your bone. And once it reaches your bone, it can cause the limb to become non-functional, in which amputation would be necessary. An infection can also reach into your blood and can cause shock and death. If you notice that you have any redness, swelling, pain, or a bad odor coming from your feet, you should go to the doctor. If you have other symptoms such as fever or chills, you should go to the doctor. You see the picture to the bottom right. That just shows a progression of an infection becoming worse and worse, in which an amputation may be needed if it gets all the way to that last picture there. So I wanted to talk about wound assessment. Um, these are just some tips on how to assess your own wounds if you do develop them, because it is important to have your own knowledge of how to be able to look at your wound and be able to treat it, and also know when to go to the doctor. So a wound is a break in the skin and the tissue underneath the skin. And what I mean by tissue is it's the skin itself, it's muscle and bone and even the fat tissue. A wound can cause in pain and infection, and it can develop in different ways other than just diabetes, such as from pressure, accidents, or from surgery. And we can assess wounds with the acronym TIME. T stands for tissue, I stands for infection, M is for moisture, and E is for edges. To begin, T for tissue, which I had mentioned before, is the skin, fat, muscle, and bone. And you can assess this by looking at the color of the wound. If it is pink or red, then continue to protect it until it heals. If the wound appears yellow, brown, gray, or black, this can mean that it is infected and you should go see a doctor for more guidance. I is for infection. A wound can become infected if it is not properly protected while it is healing. If the wound becomes red, swollen, painful, and smelly, then an infection may be present and you may need antibiotics, so you should go see the doctor. M is for moisture. Moisture, it means fluid that is produced by the wound. If the fluid is clear and thin, this could just mean the body's reacting to the wound and it is healing. If the fluid is thick and gray, green, or yellow, this can mean an infection is present and you should go to the doctor. And lastly, E is for edges, which is the skin around the wound. You can measure your own wound to be able to assess if it's getting bigger or smaller with a tape measure or ruler. You can assess the length and the width of it. If your wound isn't healing properly and it's getting bigger, then you should go to the doctor as well. Also want to talk about how to manage and care for your wounds if you do have them. And these are just some ways to help your wounds heal. So wash your hands often to prevent infection. Keeping the wound clean as prescribed, so your doctor should be able to tell you what kind of dressing is needed for the wound and how to protect your wound properly, because wounds are different. Eating healthy foods that we talked about previously, keeping pressure off the wound to prevent further injury, and take antibiotics as prescribed because you don't want the infection to become worse. I also want to talk about how you can prevent diabetic wounds specifically, because these are a specific type of wound. And if you do have diabetes, you're at greater risk for diabetic wounds. So checking your feet daily with a mirror is very important to be able to check if you have cuts or injuries, because you don't want these to lead into worsened wounds or infections. Washing your feet daily, but not constantly keep your feet like with a lot of moisture or with a lot of water. Don't constantly soak your feet, because this can lead to blisters or wounds that can develop. Trim your toenails straight across to prevent further injury. Protect your feet from the heat or cold, because, like I said previously, you do have poor sensation of your feet, and you won't be able to tell if your feet are enduring some type of hot or cold environment. And you should get your feet checked regularly by a doctor, either a podiatrist, your PCP, or your diabetic doctor. It is important to go. Sorry, about it is important to go to the doctor if you do develop cuts or blisters that do not heal in a few days, because you don't want an infection to develop. And if your feet become red, swollen, or painful, this can mean that you have an infection present, and go see your doctor. So these are just some takeaways, some big things that we talked about throughout this presentation. What is diabetes? It's poor control of your blood sugar in your body. How to monitor it with the A1C test and their finger stick test. Lifestyle changes such as diet and exercise, which is very important to control your blood sugar and also prevent diabetes if you do not have it. And how to prevent complication, which is to check your feet daily and make sure that you constantly monitor your wounds, assess your wounds, and take care of them to prevent them from becoming infected. And this is just a post-survey link that we want you guys to take after you had watched this video, just to reassess what you learned and also to assess us, the presenters, and see how well we did. And lastly, these are our resources. Thank you for watching. I hope you learned something new, and I hope you are able to have full, healthy lives. Thank you.
Thank you.